Awesome. All right, well, there's new recommendations this year against using PSA tests to screen healthy men for prostate cancer. Against it, Dr. Samadi?
Well, U.S. Task Force this year came up and said that men that are healthy over the age of 50 should not get any PSA because it doesn't help them with mortality. Similar recommendation to mammogram, which, as you know, it caused a lot of controversy in this country. They looked at two studies, one from Europe and America with 9-year follow-up, and they said, well, during this period, it didn't cause or help these men, so we don't recommend it, which was a little bogus because most studies, a longer term from Sweden, 14 years, showed that PSA actually saves lives. Now, we know that PSA stands for Prostate Specific Antigen, not Prostate Cancer Specific Antigen. So things such as enlarged prostate, inflammation of prostate, and prostate cancer can elevate the PSA. You have to make sure that you talk to a doctor and find out who is at risk. We call it risk stratification. One person may be at risk and the other one is not. Not every elevated PSA means biopsy. Not every positive biopsy means surgery. Now, this is what we are talking about in the urologic field. If the PSA found the cancer and the outcome from the prostate cancer was perfect, in a good world, everyone is cured, everyone is continent, and everyone had sexually active, then the PSA would get a Nobel Prize, right? Everyone would say, this guy helped me. What I would say is we need to concentrate on improving our outcome and better trained surgeons, maybe the technology, experience of oncology, and help our patient not to put our head in the sand and say, no PSA. That's all we have.
But quickly on the test, because I know the next topic is for Dr. Siegel. Dr. Samadi, what about physical examination for healthy men instead of the PSA test? Is that enough?
It's not enough. It's not instead. You need to have the exam and the PSA, and I'm glad you brought it up, because even we see prostate cancer in younger men in their 40s and 50s.
It's part of the art of medicine, and there's 30% less deaths from prostate cancer since the PSA came into practice, and 30,000 men are still dying of prostate cancer. I need this arrow in my quiver. As a primary care doctor, I do a PSA on every man over the age of 40. Once I have the PSA, question is what I do with it. Do I recheck it? Do I follow it? Do I look for a trend? Do I send the patient to Dr. Samadi? It depends on the patient.
I'm glad that Mark is on board, because a lot of internists are always having doubt about PSA. So
it's a great test.
It's absolutely.